Good evening, all. Uh, Thank you for all attending this very important topic, awareness of autism spectrum disorder. And I'm very happy to have Dr. Shruti, who is a family physician practicing integrative medicine. She has been working with special needs children since 5 years using homeopathy, CBD, herbal medicine, and nutrition medicine. Thank you, doctor, for addressing us all today here. Over to you, doctor.
Thank you so much, Nikki. So, good evening, everybody, and thank you for taking the time during a weekday in the evening and attending the session. I have been attached to Kansa, I think, since it began last year in May, and they are doing a wonderful job in Chennai and also seeing clients, I think, all over India. And they are primarily doing it in terms of cannabis-based medicines, that is CBD, plus Ayurveda, acupuncture, and integrating a lot of things. So very similar mindsets both of us have. Today's topic, it was supposed to be just CBD and autism spectrum disorders, but I felt that it is very unfair to just talk about CBD when autism in general is a very complicated thing. It has got different facets to it that need to be addressed. And just addressing one thing by giving one medicine is not going to fix many issues. So I have just put in whatever my previous 5 to 6 years of experience has been there working with special needs children. And I have learned from a lot from the parents of these kids. It was just, I think, fortunate that 4 5 years ago, there is a special school right next to my clinic, and the principal, I had a chance to meet the principal, and then I started working with some of the kids over there, and then slowly, slowly, it started growing. I never thought as a general physician, I will be working so much with special needs children. So I'm going to start my presentation now, and I'll try to finish off in half an hour so that we'll have time for Q&A and discussions and all that. I'll just share my screen. Nikki, is my screen visible?
Yes, doctor, it's visible. We're able to see it.
Yeah. Okay. So how do we integrate CBD or cannabidiol in autism spectrum disorders? Before we get there, I want to give a background about what is ASD or autism spectrum disorder. I think most of you that have joined us today are parents to special needs children. There are some doctors as well. So when it comes to diagnosis of the spectrum, there are different aspects that are taken into consideration, right? There is social aspect, the eye contact, socializing, how they mingle with other children, etc. There is the communication. Are they verbal? Are they non-verbal? Is it repetitive words? Is it just echoing? What are the kids doing, or what are these children doing? Then there are behavioral issues which come under, they are a big banner in itself. So there is temper tantrums, uh, hitting, aggressive behavior, biting, etc., etc. Not just behavior at home, but also behavior in social circumstances. Then there are sensory issues which are to be dealt with. So sensitivity to touch, sensitivity to water, sensitivity to light, sensitivity to different forms of textures or food textures. So that is also a big part of ASD. And lastly, we are talking about attention. So there is attention deficit. It could be attention deficit with hyperactivity, or it could be just simply attention deficit and lack of focus. So lot of things come under the spectrum of what we call as ASD. And this, in this spectrum, the range is so vast that it is very difficult to comment on a particular case without understanding where on the spectrum it is like. So sometimes, I still get calls from parents who say, can CBD cure my child's autism? So this makes me understand that the understanding about ASD itself is very limited in lot of the families, and it is very unfortunate. So if you see in the spectrum, you start from high functioning autism or Asperger's syndrome, etc., where they have extreme levels of capability in certain areas. IQ is also very high, but obviously their social skills are compromised. We can see that. Then there is above average IQ, then average IQ, and then you start with mild learning disability, where we see with mild autism, where there is global developmental delay, slow learning, delayed learning, but learning is there. We go here. And then you have moderate learning disability and severe learning disability, where there is classical autism, we call it, where there is absolutely, probably there is no verbal this thing, no verbal communication. There is a lot of aggressive behavior, repetitive hand movements, lack of eye contact. It's a classical autism spectrum we are able to see. So that is there. So through this entire range, the child can lie anywhere, and I believe that the child can also move through the spectrum. I have observed that over the last 5 years, like somebody who has was moderate learning disability has become mild over a few years after doing treatments and therapy and all that. And I have also seen the reverse, where somebody who was moderate has become severe, especially in the puberty time. It suddenly got worse over a period of 6 months. Nothing different happened, and it got worse. This I have experienced with some of the male children. So it is a very fluid spectrum, and anybody who has been working in this area know for a fact that how difficult it is to sometimes navigate these. So which is why I want to talk about holistically what can be done in autism spectrum disorder. Now this is a very good question. Does everyone with ASD need treatment? The reason I put this question is because just 2 to 3 weeks ago, I had a mother who called me for consultation for her child. Her child is in eighth standard, somewhere between moderate, mild to moderate, learning impairment is there. He is still in a state board school. He's somehow managing in eighth standard with all the syllabus that he has. And the mother wanted to talk to me, saying that no, he still does not have social skills. He does not answer certain emotional questions, etc. And when I spoke to her at length, I spoke to her for an hour, and then I realized that child is fine. The child doesn't need treatment. The child needs career counseling in terms of where the child can go with his capability. I learned that the child was very good at swimming, and he is going to represent, going to nationals for it. He's very good at certain other sports as well. So that discussion came about where I said, okay, why don't you focus on the strengths of your child rather than focusing on certain areas like emotional quotient, which may or may not develop for your child, depend because he's on the spectrum. So you have to accept that this is how the child is going to be. So not everyone with ASD needs treatment, but who needs treatment? Specifically, when we see children are non-verbal, there is extreme violence, there is extreme hyperactivity, self-harm is there, harm to other is there is a lot of gut imbalance, there is digestive issues, there is sleep-related issues. The child is unable to sleep or screaming in the middle of the night. The child may have worms or parasite infestation. So when these problems start coming, and that hampers the overall development of the child that we are seeing, the development has suddenly stopped, those things have to be treated. So that is where the treatment part basically comes in. Okay. And by treatment, I don't mean the therapy or this, that is still going on, the speech therapy, OT, that is all going on. But this is in addition to that, whatever other medications are required for ASD. So what do I mean by integrated approach? So first, we do know that there is a genetic component to ASD, at autism spectrum disorder. And obviously, if there is a strong genetic component, it cannot be changed. If there is epigenetics, that is the way the genes expresses in a child, that may be changed with certain dietary changes, certain supplements, certain lifestyle. It can be addressed to some extent, and there could be associated with seizure disorder. Okay, we see quite frequently, especially I feel that children with high level of hyperactivity and violence, they also have some level of seizure disorder that I have observed. I've observed these things coexist a lot of the time. Then the second thing that we have to address is the gut health, which I was talking about. There is a lot of digestive issues that come. Constipation, mouth ulcers can come, poorly formed stools, lot of smelly stools, gas formation, and stomach pain, severe stomach pain, and the child doesn't know the child has stomach pain, so the child is getting aggressive, the child is getting angry. So these digestive issues have to be corrected because they will affect the absorption of the nutrients, And because of that, there will be deficiencies that will start developing, and that will lead to further complications in the child. Third thing, as I said, parasites and fungal overgrowth are commonly seen in autistic children. So, deworming them regularly or giving them antifungals if required, oral antifungals, sometimes it is required. It becomes very bad that you cannot address it with probiotics and other things. And bloating, gas, abdominal pain have to be corrected. The way I usually manage the gut issues in such kids, I use a lot of homeopathy. I use probiotics, that is good gut bacteria, magnesium supplements I use, um, and dietary changes. I have seen with gluten-free, dairy-free diet, a lot of children do very well. So gluten-free, dairy-free, I always suggest. There's no harm in trying it. If you see an improvement in 6 to 7 months, you can continue doing it. If you don't see an improvement, you can start reintroducing some of the things back into your diet. But it is definitely worth giving a try. I would say that. Then addressing deficiency. So as I said, absolute deficiency versus relative deficiency. Absolute deficiency means that there is deficiency in the diet itself. So a deficiency of iron in the diet or B12 in the diet, calcium in the diet, etc. And relative deficiency means A, you are not absorbing it properly. So diet is okay, balanced, but you're not absorbing the child is not absorbing the right nutrients, or the body is overutilizing certain nutrients and thereby there is a relative deficiency which is created. This we see a lot with omega 3 and B12 because it is very good for brain health. We have to give them omega 3 and B12 on a regular basis, folic acid also, and on a regular basis because the brain is utilizing that much. There's so much of oxidative stress which is there in the brains of such children that the body is using all the nutrients that it has to counteract the oxidative, right? So that has to be corrected. So supplements sometimes have to be continued, for a longer duration of time. Then giving nutrients for brain function, which I was telling, and antioxidants to counteract the oxidative stress that the child is going through. Then there is toxin exposure, heavy metals, pesticide, insecticide, air pollution. See, the thing is, it's not that heavy metals are causing autism. No, it's not that. But autistic children, we know some are MTHFR gene mutated, which means they are unable to detox. This is all published literature. This is all there in, on Google. You can go to PubMed and search for papers. You will get this. They are deficient. A lot of these kids are deficient in detox pathways. So whatever heavy metals we all are exposed to, unfortunately, they are unable to detox it the way we are able to do it. So we don't have too many symptoms. They have a lot more symptoms. So we have to consider that. We have to consider air pollution. We have to consider the pesticide, insecticide which come through the diet. All right. So that is the toxin exposure part. Then the immune dysfunction. Immune dysfunction is a lot of these kids have a recurrent tonsillitis. They might have recurrent cold and cough, enlarged tonsils, enlarged adenoid. Respiratory issues might come recurrently, or stomach infections also come recurrently for some of these kids. So all those things have to be addressed. And what happens is they invariably end up giving a lot of antibiotics which further damages the gut and then causes other behavioral issues and even it sometimes can even regress the progress in ASD cases. I have observed that. So I try to avoid antibiotics in such kids as much as possible. So I'll give homeopathy, I'll give vitamin C, zinc for immune boosting. So like that, I will try to manage them as naturally as possible. Of course, in 10-15% cases, we have to use antibiotics when the infection gets too severe. But through these methods, we can by and large, keep these children away from heavy drugs. Then optimizing sleep. Now, this is very, very important. I read a paper which said that in autistic kids, there is a cycle of melatonin which they have observed where the melatonin peaks and then dips every 2 to 3 weeks. Now, why it happens, we don't know. There, it could be a genetic thing in the melatonin production of the brain. And some kids are deficient in natural melatonin production itself. And these kids have heavy issues sleeping. So they don't sleep at all. They sleep very late or they have very disturbed sleep. And when they don't sleep for days together, they might end up with a seizure after 10 to 15 days. Okay, this also happens quite frequently. So melatonin dysregulation takes place and there is magnesium deficiency. So both of these have to be supplemented in such kids. I sometimes do cyclical supplementation of melatonin where I give it for a week, then break for 2 weeks, then again give it for a week. So it depends on the child, how the child is presenting in terms of symptoms. And once the sleep is corrected, the hyperactivity automatically improves, like beautifully it improves. And there is a reduction in their behavior. They start learning better, they start speaking better, so everything starts improving after that. And then lastly, the behavioral and sensory issue. Here there is a big role of therapy which is there. And I would say there is also some role of homeopathy, because I have seen some improvement with homeopathy in behavioral and sensory issues. So I add that. And once the sleep is optimized, the digestion is optimized, automatically behavioral issues start improving. So, like I have seen in some kids, when we do when we do, deworming in those children, suddenly their aggression goes away. They stop screaming. They're grinding the teeth in the night. That will stop beautifully. Just 2 doses of the deworming and it is done. They might need it 6 to 8 months later, but then for that time period, they're doing fine. So this, I think, this gives a very good picture of why a holistic addressing of ASD is a must. And we have to look at one particular case only from multiple angles to understand where what is going wrong. Okay. So once we have a background of this, I can talk about where CBD or cannabidiol fits into the ASD treatment, integrated treatment. So where all it can be helpful and what all results I've also seen in these kids. And again, I'm not saying this will work for 100% of children. I have seen children who have responded very beautifully to CBD. That is one end of the spectrum. The other end of the spectrum, I have seen children who had no response to CBD. That is little less, so maybe 10 to 15%. And the remaining, they lie somewhere in the middle, where we see 30 to 50, 60% improvement in all of the symptoms. Okay. So what is CBD? So CBD is the short form of cannabidiol, which is one of the more than 100 cannabinoids which are present in the cannabis plant. It is extracted from cannabis, yes, but it is not, it's one of the 100 cannabis. Remember that. And it is devoid of any intoxicating effect and has a wide range of therapeutic benefit on human brain, not just for autistic kids, but also for neurotypical people. So I have been using CBD for anxiety issues, I've been using it for epileptic disorders, been using it for chronic pain cases where inflammation is high. I've been using it in adults as well as in children, as well as in geriatric or old age people also, with very good results. It is one of the most researched molecules. And the reason it happened was when they started the research, they wanted to do it to prove that cannabis is bad and CBD is bad, and they put a lot of funding behind it. But what turned out was completely magical and completely opposite of what they were trying to prove. So, in this process, we have accumulated a vast knowledge of research about CBD, and we know that it has minimal to no side effects. And I'll tell you why the minimal side effects also happen. It is, again, I'm repeating this, it is non-psychoactive, non-addictive, and it is safe to use in children. I have given it to my daughter also. Sometimes when she doesn't sleep, I give few drops of CBD oil and then she sleeps also. I've done that also. It's very, very safe. FDA has approved CBD for Lennox-Gastaut syndrome and Dravet syndrome, in which there is very frequent epileptic seizures. It is also approved for treatment resistant epilepsy. Even Canada has approved it, and there is sufficient evidence to warrant its use in anxiety, PTSD, and chronic pain. CBD is non-sedating, so it will not put you to sleep or put the child to sleep. This is another very common question I get asked. So when you put a child on allopathic medications, you're putting the child on Risnia and carbamazepine and other drugs, it sedates the child a lot. The child becomes drowsy. The child is unable to function as normally as it would, as they would. And this is a question which I get asked is CBD also sedating? CBD is not sedating. Of course, if the child ends up taking the entire bottle, the he or she will go to sleep. That will happen. But it will get cleared off from the system in the next 24 hours, and the child will be good to go after that. So even there is no fear of intoxication or excess dosage because nothing major happens. And you can do routine activities after consuming it. There are certain drug interactions which are there, which the doctors are aware of. And these drug interactions are mainly with anti-anxiety medications and epileptic medications. So if the child is taking that, then we have to adjust the dose accordingly. If the child, because when you take it together, the side effect of the allopathic medicine, the anti-anxiety or anti-epileptic medicine increases because of the CBD. So we have to dose adjust a little bit. So with children who have seizures, I tell them please work with your neurologist. I even talk to the neurologist. I tell them this is what I'm giving them. This is the dose. These could be the side effects because the child is on these medications. So I explain that very clearly to the neurologist, and I've been surprised that they have been open to this because they have seen how much the child is suffering. You know, even with medication, sometimes the seizures are not under control. So in those cases, CBD works beautifully. In this, I'll tell you, I had one case of, I still have her, but she's doing very well now, reflective seizures, in which the child would get seizures if anything sudden happens, like a sudden noise or a sudden fall, sudden light, anything loud noise, and the seizures will be triggered. And after CBD, they almost became zero. Like her mom told me that she could stand next to the loudspeaker when the school function was taking place. She was also, everybody was surprised, and this was within 1 month of starting the treatment, you know. So I have seen some beautiful results with CBD. So what all, which all areas it can help? Okay, one main thing is anxiety and stress reduction. There is a lot of anxiety that these children have, and they don't know how to express it. They don't know it's anxiety. It comes out as aggression, it can come out as screaming, just running around. It will reduce the anxiety, reduce the stress. It will improve the behavioral issues because it increases the GABAergic neurons in the brain. Now, GABA is an inhibitory neurotransmitter. That is, it is a neurotransmitter which stops the excitation of the brain. So it increases GABA, and thereby it helps to calm down a person. So therefore, the behavioral issues start improving. Sleep issues beautifully improves. I use melatonin in combination with CBD and magnesium, and I have seen beautiful results with sleep. Gut healing. CBD also improves the gut. It improves digestion, it reduces inflammation, and it also helps to strengthen the leaky gut, which we call it the gut barrier. So thereby also it helps in the overall development of the child. It reduces the sensory sensitivity. Here I had explained you the case of reflective seizures. Similarly, it reduces sensitivity of light, sound, because see, sensory issues are nothing but overexcitation of the brain to the smallest possible impulse. So when the general overexcitation comes down, there is automatic, improvement in sensory issues. And then lastly, it helps in control of seizures if the child is having them. So these are the different ways in which CBD can help a child who is in the ASD or autism spectrum disorder. So I think this brings to the end of my presentation. If I have rushed through some parts, if you need any clarifications, please ask me. I purposely rushed through some parts because I wanted to leave some time for discussion and questions and all of that.
Doc, I have a question.
Oh, tell me.
So, how, okay, when we talk about melatonin, and now that it has become, a lot of doctors say it's not very safe, it's not really very good. And uh, how important is melatonin for a child? Like you
Mm.
said, in autism, apart from that, normally, how important is it for a child? And by giving them external medications as melatonin, is it safe? Does it have any effects
Mm.
with the medications that they're already taking and with the CBD medicines?
So, as I said, this melatonin dysregulation is a part of the autistic spectrum disorder. And that is the reason why some of the kids are unable to sleep at all. They are unable to wind down for the night. Melatonin is a hormone which we start releasing around 8 to 9 p.m. in the night as the sun sets, and then slowly it peaks by 11, 12 midnight. That is the peak. That is when ideally you are supposed to be in your deep sleep. And then it slowly start decreasing by the time 4, 5 a.m. that you're ready to get up. So this rhythm of melatonin gets disrupted in some of these kids. So it's like this, if you have deficiency in thyroid, you will be taking thyroxine, right? It's something like that. Unfortunately, we don't have tests for melatonin. And so far, that I have read and researched on it, there is no danger of taking melatonin at the physiological doses that we are giving. There is also a new research which is saying that microdosing melatonin also helps, which is zero point 0.3 mg of melatonin every night. We don't get this dose in India, unfortunately. The minimum dose that we get is 3 mg, and you can maybe half the tablet and take 1.5 mg. But I usually start with 3 mg, and I don't give melatonin regularly. I always give it for 2 months, 3 months, then break. And if I see that there is a cyclical pattern, like every month, 1 week, the melatonin is going off and the child is not sleeping. So only that 1 week I will give and then I'll again take it off. So I don't keep the child on melatonin continuously. And melatonin, I feel, works synergistically with CBD. There is no interaction, but it boosts the effect of each other very well. The sleep is much better.
Thank you, Doc.
Yeah.
Uh, we are open to questions and discussions. So please feel free to talk to Dr. Shruti and get it clarified. Yeah, I have another question, Dr. Shruti.
Hmm.
So is CBD habit forming?
Absolutely not. I think I put that in the slide also. It's
Yes.
absolutely not addictive. And it is non-psychoactive. So only the molecules that are psychoactive and that create a high can also create an addiction. CBD does not have a psychoactive component, so there is no addiction. Although it can happen that when this happened to couple of the kids, when they stopped taking it, for some reason, like the medicine got over, they forgot to order it, and then the seizures increased in the meantime. Because the CBD is controlling the seizures and you don't take the medication, then the seizures might come back. That is possible.
Mhm. We have a question. How do we fix the dosage of CBD? The child with ASD is on antipsychotic drugs.
This is a very technical question. It's hard to answer here. Yeah, Dr. Rusta, you can reach out to Dr. Nikki. I think she will be able to guide you if you have a particular case. So we just have to look at what antipsychotic drugs the child is on and see the interactions. And if there are interactions, then you start with a low dose, keep monitoring the liver function test maybe once in 3 months and see if it's all fine. So we have to keep monitoring. That is the thing. Yeah. And if you're not a psychiatrist, I don't know if you're a psychiatrist or not, or a child neurologist, uh, maybe work with the doctor. You tell the doctor that this is what I'm giving the child, so please adjust the doses accordingly. I think that works better rather than trying to manage the doses by ourselves. Yes, Mr. De Silva. Mr. Miss. You can unmute and ask, no problem.
Yes, good evening, Doctor. Thank you very much for your session. So, the question that I want to ask is actually regarding my son. He's on the spectrum and he's 15 now.
Hmm.
So, at some point in time, he was.
And Nikki, can we close the session? Do we have any other questions?
Yes, I see a lot of doctors on the call. Doctors, if y'all have any questions regarding CBD, I think y'all should ask. This is the right time.
No, no, we should talk to them separately with dosing. They'll have too many questions, drug interactions, dosing, all that will come.
All right.
Melatonin is form of tablet. Yes, melatonin is the form of tablet. There's also drops which are available for kids. That also can be given on 1 mg or Amazon, but you will need a supplement. You need a prescription for melatonin. You won't get it without prescription. The brand is, I think, Altonil, the name of the brand. Uh, you can get it in pharmacy also. They have, because pediatricians also use it sometimes for children. But you need a prescription for that.
Okay. Uh, okay, I'm going to wind up this session. Dr. Shruti, thank you so much for collaborating with us. And I think your all this half an hour has given us a lot of information for both doctors and parents. And I hope to continue collaborating with you through Kansa and learning more from you. Thank you so
Yes,
much.
definitely.
Thank
Thank
you
you so
for
much.
all the people who've joined us today.
And
If you
and
need
reach
Dr.
out to
Shruti's
Kansa.
number,
Yeah.
yes, please reach out to Kansa Healthcare. We will share Dr. Shruti's number. You can take up for consultations. Please feel free to send us a message. I'll put in the number in the chat box. Thank you, Dr. Shruti.
Thank
Thank you so
you.
much.
Very good evening to everyone.
Thank
Good
you. I'll just
night.
share the number on the
Thank
group.
you.
Thank you so much.
Thank you for the nice session. Thank you. Thank you so much.
Thank you. Thank